Hi everybody and welcome back. In this video we're going to talk about the acetylcholine receptors on the muscle membrane, the post-junctional membrane. So that's going to be these guys right here. So we kind of addressed them a little bit in the overview video on neuromuscular transmission, and we talked a little bit about how they work, but in this video we're going to dive into a bit more detail. So here is a diagram of the nicotinic acetylcholine receptor that is located on the muscle membrane, which is on the post-junctional side of the neuromuscular junction. You can see that it is a transmembrane protein in that it spans the width of the muscle membrane from the cytosol to the exterior of the membrane. There are 5 of these protein subunits. You can see that there are 2 of the alpha subunits. There is a beta subunit in blue here, a delta in the gray, and an epsilon in the orange. So there's 5 of these subunits, and they come together to form this. It's been described as a rosette. It's also been described as taking the shape of like the rungs of wood in a barrel to create this sort of cylindrical receptor structure. You can see here that there's these acetylcholine binding sites, and they're located on the alpha-1 subunits here, the pink subunits. And this is where the acetylcholine molecules are going to bind and cause a conformational change in the receptor, which I'll show you shortly. There are 3 isoforms of the nicotinic acetylcholine receptor. And really the most important one to think of when we talk about neuromuscular physiology and the normal physiology of neuromuscular transmission is the junctional mature receptor, and that's this one in the orange here. These other 2 receptors I'll touch on briefly, but they're more important when we start to get into pathophysiology. These extrajunctional or immature/fetal receptors are very similar to the junctional receptors, except they have one change in the subunits. So instead of an epsilon subunit, you can see here that they have a gamma. So there's a substitution of the gamma for the epsilon subunits. And while that seems a small change, what that does is it makes these immature receptors open. The pore opens for a longer period of time than the mature receptor. These immature receptors, like the fetal extrajunctional receptors, these come in quite important when we start talking about denervation states like burns or prolonged immobility or prolonged ICU stays, where there is a upregulation of these immature receptors, and these are the ones that pose a particular risk when giving drugs like succinylcholine, and we'll get to those later on when we get to videos about that. Finally, these neuronal alpha-7 receptors that you see at the bottom, these are kind of a more recently discovered isoforms of the acetylcholine receptor, and they have 5 of these alpha-7 subunits. So they look quite different to the mature receptors. What I'd like to do now is focus on the junctional mature receptor, the one that is shown in this diagram, and show what this receptor looks like under different circumstances. So let's pull those up now. What you can see in this diagram is the mature junctional acetylcholine receptor, the one I said was the most important for normal physiology of neuromuscular transmission. You can see it has the 2 alpha-1 subunits. It says alpha, but these are alpha-1 subunits. There's a beta subunit, a delta subunit, and an epsilon subunit, okay? And we said that there was these 2 binding sites that acetylcholine are going to bind to. So we're going to look at each of these 4 receptors and kind of look at what's going on. Let's take a look at this first receptor on the left. This one is closed. So we'll just write closed down here. And the reason it's closed is because there's no acetylcholine binding to the acetylcholine binding sites. So it stays in its closed conformation. The sort of 5 protein ring stays kind of tightly bound to itself, and there's no channel there for ions to flow down. because there's no acetylcholine binding to the binding sites. How about in this second example here? In this example, we have one acetylcholine that's binding to this binding site on the left, is the blue acetylcholine blob. But on the other binding site of the alpha 1, there is no acetylcholine bound to that one. So this receptor is closed. Because as we've said in the previous videos, you need 2 acetylcholine molecules to bind to the receptor in order for it to undergo that conformational change and open the pore in the middle for the ions to flow through. So this receptor is kind of in a limbo state. What happens to this one will depend on what binds to that second binding site. If over here where we have this no ACH, if acetylcholine was to bind to that site, then the receptor is going to open because there's now two acetylcholine molecules bound to the receptor. If something else bound to it, again, we'll get into these in future videos, but let's say something like a neuromuscular blocking agent was to bind to this binding site, then this receptor would stay closed because 2 acetylcholines are required to open the receptor. In this example here, we can see that this receptor is open. And the reason is there's now 2 of these acetylcholine molecules has bound to the binding sites. And what that does when those 2 are bound is this receptor will undergo a sort of conformational change. It will sort of rotate on a central axis and it'll open a pore in the middle of the channel. And you can almost see how the 5 subunits have sort of flayed out a little bit, almost like a flower, and opened the central pore in the middle of the channel. And what that does is it allows ions to flow down their concentration gradients into and out of the cell, respectively. So up here, you can see we have calcium and sodium are going to rush down their concentration gradients into the cell. Sodium is particularly important for this. That is what causes the major sort of change in the membrane potential of this membrane, and will activate that membrane potential change will activate the sodium channels that we talked about in previous videos. But you can also see importantly that potassium here is leaving the cell. We know that potassium is a predominantly intracellular ion. Its concentration is predominantly inside the cell. And this opening of this receptor allows that potassium to go out via its concentration gradient and go to the outside of the cell. And this is going to become important when we start talking about the use of succinylcholine as a depolarizing muscle relaxant. But we'll get to that in future videos. But just remember this efflux of potassium out of this nicotinic acetylcholine receptor, because that's going to become important later on. And then finally, on the right here, this receptor, again, is closed. But this one's closed for a different reason to the ones on the left. This one's closed because we have a drug or a molecule blocking one of the 2 binding sites for acetylcholine. And we're sort of foreshadowing here to some future videos, but this is a non-depolarizing muscle relaxant. So this is a drug that's blocking right here. This is blocking one of the acetylcholine binding sites, which means that the receptor will stay closed. Because as we've already learned, you need 2 acetylcholine molecules to bind to both of the receptors. So 1 on each of the binding sites to allow this receptor to open. So blocking one of the acetylcholine binding sites with a neuromuscular blocking agent will cause this to be stay closed. So for this one, we can say that this is blocked. So hopefully this video has given you a little bit more detail into how these nicotinic acetylcholine receptors work, what is required for them to open, and a little bit of a preview into how neuromuscular blocking agents can interact with these receptors to have the clinical effect that we desire in the operating room.